There's a lot of talk and arguing in the country right now about reforming health care. President Obama would have insurance companies cover more of our medical expenses and lower deductibles. But John Stossel argues that when people pay less, they eventually pay more.
I need you, boy. You got me covered.
The singer in this popular video sings,
If you really wanna be my man, boy, you gotta put me on your healthcare plan.
and politicians promise more health insurance coverage.
And cover everyone.
They cover everyone.
Cover more people.
But wait a second. Health insurance means someone else pays your bills. When that happens,
Charts.
there's more paperwork.
More here, everywhere. This is where some of the money goes. This stuff is not free.
This doctor pays 4 employees just to do insurance paperwork. On average, doctors spend 14% of their income on it. But that's just the first problem. The bigger problem is that with insurance, someone else foots the bill. So patients often don't care what things cost.
The patients have insurance, they don't ask. They just say, some of them tell them, do this, do that. And some of the things they don't need to have done.
Insurance was designed for big catastrophes like cancer or heart attacks, but now people expect it to cover everything.
I need a flu shot, baby.
I asked the video's singers and songwriters.
You can get a flu shot at Walmart for about $20. Why not just pay for it yourself?
Come on, everybody wants more and now and cheaper and better.
And we need health care the way we need shelter and groceries. But think about that. What if you had grocery insurance? You wouldn't care what things cost. Why buy hamburger? I'll just buy steak. So why look for sales? I'll just buy everything. My insurance company's paying.
We'd make a lot more money.
You could raise your prices.
We definitely could.
John Mackey's founder of the chain Whole Foods. He laughs at how grocery insurance would change shoppers' behavior.
They'd buy a lot more. Instead of buying a bottle of wine for $7.99, they might buy a $300 bottle of wine.
And yet this is how we pay for health care.
I know, it's ridiculous.
Now the president says insurance companies should cover more. He wants to reduce copays.
Will limit the amount your insurance company can force you to pay out of your own pocket.
That sounds nice. We can get free
Acupuncture. How about podiatry?
I don't need none of those fancy.
You want some LASIK, baby?
LASIK? Wait a second. That surgery is one of the few that insurance does not pay for.
Okay, you can open your eyes.
And guess what? LASIK keeps getting cheaper.
That looks great.
In every other field of medicine, the price is going up faster than consumer prices in general. But the price of LASIK surgery on average has gone down by 30%.
Prices drop because without insurance payments, patients shop around to get the best deal.
I can't get away with not telling the patient how much exactly it's going to cost. No one would put up with it. And a difference of $100 sometimes makes their decision for them.
I started thinking, well, what am I getting for this price?
Sherilyn Schmidt also thinks about prices because now she has to pay for routine care. She works for John Mackey's grocery chain, which offers health savings accounts that include high-deductible insurance. If workers get cancer or heart disease, insurance pays. But for the smaller stuff, they pay.
It's my money.
When marketing director Marianne Buttrose went to the doctor, she never used to ask,
Well, how much will this cost? Because it didn't matter. And I'll get someone to help. And now it matters to me because it's my money.
At last, I can go to that acupuncturist. At last, I can spend the money the way I want to spend it.
You try this new system, and what happened?
Our cost went way down.
Because it changed behavior.
They started asking how much things cost. They may not want to go to the emergency room if they wake up with a hangnail in the middle of the night.
They didn't ask what things cost before.
Why should they? Somebody else is paying for it.
Sherilyn Schmidt used her account when she wanted to get a physical. Since it was her money, she shopped around, found prices varied by hundreds of dollars.
If I had regular insurance, I would have never called around and asked for prices.
But it's hard to find out the price.
So I'm trying to find out how much it's going to cost.
Computer programmer Mark Horn has 4 kids and an insurance policy with a $5,000 deductible. So he wants to know what things cost. When I blogged about how insurance raises costs, he emailed to say insurance makes it impossible for him to find out what things cost.
We currently accept Aetna, Blue Cross and Blue Shield, United Healthcare, MedCost Preferred.
This recording says what insurance they'll take. But if you want to pay cash?
PHCS, Alliance PPO, Medicare, MAMSI.
The physician themselves never know. So they may refer me to the front desk.
If you know your party's extension,
but they usually don't know the cost either. Every other service that I use, they tell me what it costs.
For the business office, press 2.
But with healthcare, it's not like that. It's just a crapshoot.
He can't even find out what things cost.
Right, that's a big part of the problem. Patients are in a black hole.
Michael Tuffin speaks for the health insurance lobby.
And we've had a system arise over many years that is not transparent.
It's not transparent because of you. Here's a graph of how what the person pays has dropped and how healthcare costs have risen. Isn't one causing the other?
Well, there's no question there needs to be some personal responsibility.
When you're involved, there's less personal responsibility.
When we're involved, there's protection against the devastating cost of serious illness.
But don't you admit this does cause people to overuse healthcare?
No, I don't think people are waking up in the morning going, gee, how do I get myself into the hospital today?
No, of course not. And it's good that insurance covers catastrophes. But when insurance pays for everything, customers can't push providers to lower costs.
I have almost no ability to influence them. I have no ability to say to Dr. A, I don't like the price of your service, I'm going to Dr. B. I just can't do it. And the reason is because somebody else is paying for it. Why on earth, for health care, do we as a society think somebody else should pay for it? We don't think that about groceries. We don't think that about cars. We don't think that about anything except health care.
Your healthcare plan.